We're good? Perfect. Can everybody hear me all right? Perfect. Thank you to Andrew and to Michelle for the invite to be here this evening. As you can see from my slide here, I'm going to be talking about the role of physical activity in cancer survivorship, and then specifically about the ACE program, which is available to all cancer survivors here in Alberta. As a bit of a background, as Michelle mentioned, I'm a professor in kinesiology. My background is health and exercise psychology, so I really come at this from the patient's perspective of how can we use physical activity to enhance the quality of life and the sense of well-being in cancer survivorship. At the University of Calgary, I have the Health and Wellness Lab, and the focus on our lab is to conduct really good research, but to translate that research into sustainable community programs. So we take evidence that we build as well as evidence from colleagues and then say, how do we give this back to the patients? How do we do that? Michelle mentioned the Thrive program. That's one of the offerings that is available to cancer survivors, and I'm going to tell you about a couple others as well. But really, first, before I get into the resources, I just want to set the stage a little bit and acknowledge what are we actually talking about here, because there's lots of different terms. So how many people in the room exercise? Most of you. Okay. And so exercise, maybe not. Exercise is that structured physical activity that you engage in for health benefits. So often we think about it as, oh, okay, if I'm told to exercise, I have to go to the gym or I have to go to a program. Okay, so that's kind of one level. Physical activity is the broader umbrella that exercise fits under. So physical activity is all the movement that you do. So how many people parked somewhere down the street and then walked through the rain to the building? How many people valet parked like me so you didn't have to go walk through the rain? Yeah, okay, so walking, okay, parking a little bit further away, getting more steps in, okay, that's physical activity. So that's all the movement you do. And oftentimes you'll hear from your oncologist or your doctor or your nurse, go and engage in more exercise. And if you aren't an exerciser, that really doesn't sound all that appealing, or it might not even sound that achievable. So I want you to start thinking about physical activity. Where do I get my steps in? Where do I move during the day? And then even more basic than physical activity is this idea of movement. And really, if you remember nothing else from the talk today, I hope you remember the message is that you need to move more. Okay, so we want to move from this guy sitting on the couch and avoiding moving, which often happens when individuals are diagnosed with cancer and they feel sick and they're going through treatment and they have side effects and complications. We move less and less and less. And really, all of the evidence suggests that you should move more. And it doesn't have to be exercise. It doesn't have to be going hard and sweating. It's just about moving your body. So really moving from this guy to this idea of where can you put movement into your usual activities, right? When you are sitting down watching the last couple hockey games or watching baseball, can you just do some arm curls with or without weights? When you're at work, can you stand up instead of sitting down for meetings? Can you stretch a little bit? Right? It's all of those little things that really start to make the difference and then help people really build up into that habit of moving regularly and maybe eventually becoming exercisers, even you. Okay? So I'm going to tell you a little bit about the evidence, and what we know is across cancer types, different populations, different studies, we know that exercise is both safe and beneficial. Okay, and we've got evidence from pre-treatment, so we call these prehabilitation studies. So can we get somebody in better shape so that they can tolerate treatment better? And we've seen that mostly in lung cancer, all the way through to survivorship and palliative care. And as the notion of palliative care changes and we talk more about supportive care throughout the cancer journey, where really is the role of exercise through all that? So most of our research really goes into these two, treatment and then the immediate post-treatment phases. And we have really strong evidence that when we apply exercise properly, so when it's done safely and within guidelines, we see benefits. And we see a host of benefits depending on what's going on. And really, we tend to look at this kind of like a tug of war, right? So we know cancer negatively affects everything, from the individual's body at a physiological level to fitness levels to psychosocial well-being to overall quality of life and survival. Physical activity has the potential to positively affect every single thing that cancer negatively affects. Okay, so the best thing that we can do for body composition and maintaining ideal body weight is move. Okay, we have to have some aspect of nutrition in there as well, but there's really strong evidence that nutrition alone isn't the answer, that you have to have some movement in there. Okay, the big one in cancer survivorship, and I know it's a big one in the stem cell groups, is this fatigue management. And I'm going to show you some specific studies that while it may seem counterintuitive, when you're tired, one of the best things that you can do is move a little bit and then move a little bit more, and we break that cycle of fatigue. because if you're tired and you sit and rest, you physically decondition, and that deconditioning leads to more fatigue. Okay, and it's not about going out for a 60-minute jog, but it might be a 5-minute break just to get the blood flowing, okay, and move a little bit more. Okay, so again, move more, and move more. So what is the actual research in this patient population? So this is one of the very first studies that was done by Dimio, looking at an exercise program after bone marrow transplantation. And they had just 20 patients. So the first few studies that were done, really small patient sample sizes, so 20 patients. But what they essentially saw was that in the group that exercised, 6 weeks after transplantation, they didn't look that much different from the control group, the group that didn't exercise. But 7 weeks after that, there was no reporting in fatigue in the group that exercised compared to everybody in the non-exercising group. Okay, so there's something about timing and really this idea that we can enhance recovery by using exercise during the rehabilitation phase, so after treatment or maybe right as treatment is just ending and starting it in. So that was one of the earlier studies. This other study, Dimio's group as well, looked at rehabilitation of cancer patients after high-dose chemotherapy and the autologous peripheral stem cell transplantation. And same thing, found very similar results. So these first few studies were really looking at fitness changes and fatigue. That's what kind of got it going in this patient population. The more recent studies here, so this one by Bowman and colleagues out of Germany was published in 2011. And this was another RCT looking at the benefits of a moderate exercise intervention. And again, they found fitness changes so they can improve aerobic endurance and strength gains in the patients that exercised versus those who didn't. And they showed decreases in fatigue. And then this was one of the first studies that linked this to quality of life. So we started to see emotional benefits from engaging in exercise along with the fitness changes. And then this is the most recent one that was just published, 2017. And again, looking at health-related quality of life. So we see fitness changes, okay, improvements in some markers associated with the cancer, and quality of life and psychosocial benefits. Okay, and then the fatigue. And it really does appear that one of the central mechanisms that exercise is helping with is that cancer-related fatigue. And then by improving that, we enhance overall quality of life. So to date, in this patient population specifically, so we sometimes see the stem cell transplant included in large mixed studies, but there's 25 to 30 studies now just in this patient population. And across the board, we see really positive results and consistent benefits no matter what type of intervention is done. So we've got walking interventions, we've got strength training interventions, we've got treadmill and cycling interventions, consistent despite the mode, and consistent really despite the duration. So some have been about 7 weeks up to 16 weeks long. So we see variability in what's delivered and consistency in results, which gives us greater faith that there is actually something going on and a role for exercise. And you can see here, and the big one really again is this decreased fatigue. So what we consistently see is that without exercise, without adding in some rehabilitation programming and movement, fatigue remains a central concern months and even years after treatment's completed. With adding in an exercise program, we diminish that fatigue and we can get people back to their activities of daily living, what they want to be engaged in, whether it's return to work or playing with grandchildren or being able to function, and all of that works.
So are these pre or post, and at what time, like what's the best timing to start moving?
Yeah, so that is an excellent question. The timing question is one that we don't have a strict answer for across most tumor groups. Most of the research in this one, in the stem cell transplant patient populations, has been 30 plus or minus a week, 30 days after stem cell transplantation, and then starting an exercise program. And then we see the benefits not happening right away. So you're not going to alleviate some of the usual side effects, but you may diminish the usual decline, and then it makes recovery easier afterwards. But we don't have a strict, for everybody you need to start at 12 weeks or at 3 months or 4 months. We don't have that strict diagnosis available to us from the data yet. And it does seem to suggest that there's really kind of two things maybe going on. So one is fitness levels going in. So if someone came into this and they're fitter, generally they can start exercising a bit sooner and then aid that recovery a little bit faster. And then the other one is their overall health status. So if there's complications from the treatment, if there's other health concerns, comorbidities, then generally it may take, a little bit longer for that recovery and for them to actually see some of the benefits from movement. Okay, so I'm going to start talking about some of the kind of prescription pieces in a bit and where we're going and what's the dose. Okay, so this is just an overall summary. This is where a lot of the cancer and exercise research is actually going, and it's looking at the relationship between activity levels and survival. And you can see here we've got evidence in breast, prostate, colorectal, and ovarian cancers. So these are the population health studies that are done. So they're not cause and effect. We're not giving somebody something and not to somebody else. These are large-scale observational studies, tens of thousands of patients in them, and they're looking at the relationship between activity level and then morbidity and mortality. And across these 4 tumor groups, we see significantly reduced risk of cancer recurrence, cancer mortality, as well as all-cause mortality associated with moderate levels of activity. So you can see here, and I want you to remember this number, 90 minutes a week seems to start to afford benefits. Okay, a study came out 2 weeks ago from Australia showing that optimal benefits are at 360 minutes a week in this latest study in terms of survival benefits. Okay, but a lot of the work shows that at about 90 minutes, we start to see a difference between people who are active, engaging in moderate amounts of activity, versus people who report being sedentary. Okay, so again, it's not cause and effect, but very strong and substantial relationship between those things. Okay, so based on the research, I'm going to kind of jump ahead to maybe start answering your question about, well, what are we knowing from this and what are we telling patients to do? So we have guidelines. We have guidelines for cancer survivors that still have some gaps in there, and this is the one out of Australia, Buffard and colleagues. We've got lots of systematic reviews, so there's a lot. There are thousands of studies now done in cancer and exercise, so we've got a fairly large database. And we know a few things. Okay, so we've got guidelines, and these guidelines, I'm going to show you them in a minute, but they really say that all movement is beneficial and that the healthcare professional team should be advocating for movement and not rest during and after cancer treatment. Okay, and then there's really 2 big factors from my perspective, from a behavior change perspective. One is social support. So the number 1 predictor if people will maintain or continue to engage in exercise is if they have the support to do it. Okay, and that can be somebody that you work out with. It can be joining a program like I'm going to tell you about, the ACE program. And then the flip side of that is what's stopping you right now. Okay, so how many people often say, oh, I just don't have time to fit exercise in today? Anybody ever said that to themselves? Ever? Yes. All of us, okay? Time is our number 1 barrier with or without cancer. And then you add cancer on top and you feel sick and you have no energy and you're exhausted and you may have restrictions based on the type of cancer, etc. Okay, but time is our number 1 barrier. And I'm going to show you the guidelines. Our guidelines are that you get 30 minutes of movement daily. So how many people have 30 minutes of potentially free time in their day? All of us. We really do. Okay, we think we don't, but if you start to look at your day, you've got 24 hours in a day. Take away, if you're really good, 8 to 10 for sleeping. Take away another 8 to 10 for working. You still have 4 to 6 hours in there available for you to maybe be doing something else. And can you just move more during that time? Can you move more during your wake time at work as well? Okay, so thinking about that, the barriers. The other big thing, and a big thing for us, is what's accessible. Okay, because a lot of programs are only available in very select locations and maybe not accessible to the individual, and that's a big factor, and that is a true barrier. Okay, so those are important considerations. And then from a behavior change perspective, how many people have heard of SMART goals? A few of you. Okay, I'm just going to go over it very briefly. So if you leave here tonight and go, okay, that was great. She said to move more, so I'm going to move more. That's a great goal, but it's not a SMART goal. Okay, instead of saying leaving tonight and going, I'm going to move more, we want you to set a goal that is specific. So specific, I'm going to move more. Okay, that means for me, I'm going to walk 10 minutes 3 times a week. Okay, so now we can quantify it. It becomes measurable. I can actually track on my phone or on my calendar, did I achieve that 10 minutes? And check it off. If you're like me and you have a list and you like to check things off as you go along, right? Okay, so that's the measurable. And then attainable. So if you're in here right now and you're not being active at all, okay, and you hear the guidelines and they're 30 minutes most days of the week of moderate to vigorous exercise, okay, jumping right to that's probably not attainable. It's probably not going to feel that great because if you're not in good shape, jumping to that amount of activity can be hard to do. So pick something that's attainable. And it might be 5 minutes of walking twice a week, and that might be what you start with, and that's great because that's better than not moving. Okay, attainable and then relevant. What do you want to do that's relevant to your lifestyle? That's going to give you maybe energy is your goal, maybe losing some weight is a goal, maybe getting stronger so you can go up and down stairs more easily is a goal. Okay, you want to pick the activity so that it matches that lifestyle goal. And then the last one, the T, is timely. So when we have people come into our programs, we don't set goals for 6 months down the road, because that's not as motivating as setting something that you can achieve within the next few weeks. Okay, so a timely goal would be, I'm gonna walk for 10 minutes 3 times a week, and I'm gonna do that for 2 weeks. And then I can track it and see if I've obtained it, and if I've obtained it, big check, reward yourself, set a new goal. If I didn't attain it, okay, I haven't wasted 6 months not getting there, I can readjust it. I can reset that goal and then see what I can do on a realistic daily basis. Okay, so very important. If there's any behavior change technique that we know helps actually people change behaviors, it's setting their goals and then tracking their attainment of those goals. A couple other big things before we get to what you should actually be doing. Smaller bouts of exercise are okay. Okay, so you can add up your minutes over the day. So if you've got a 5-minute walk to work, or if you can be active at work, count those minutes towards your total. Okay, and the guidelines, as I'm going to show you, are for moderate to vigorous activity. Okay, and I think sometimes we do ourselves a harm by giving people these guidelines, because for a lot of people who aren't active, they're not reaching those guidelines. Okay, so mild activity is okay. If you had a tough day and you want to just stretch, do some yoga-related types of activities, okay, that is a great form of physical activity. Okay, a really light walk if you have no energy at all at the end of the day and you want to get 10 minutes in of just moving. Okay, so thinking about those things and listening to your body is really, really important. Okay, so what should you be doing? There's 3 types of activity. How many people in the room looking at the screen engage in all 3 of those activity on a weekly basis? Awesome, we have some good people in here and some not so good people. Room for improvement is always a good thing. Okay, so aerobic resistance and flexibility. And oftentimes when we talk about our guidelines, people just think about aerobic activity, walking behavior. So that's our first one. So aerobic activity is anything that rhythmic in nature and gets your heart and lungs going. Okay, so it's the walking, the cycling, the swimming. Golf, if you're walking, counts as an aerobic activity. Some forms of yoga may have an aerobic component to them. Think about when you're breathing harder, doing an activity, that's aerobic in nature. So if you're doing gardening and you're huffing and puffing, or mowing your lawn, or vacuuming your house, those could all be aerobic types of activities. Okay, and that's what we talk about when we talk about our guidelines and getting 30 minutes in on a daily basis, or most days of the week. It's this type of activity that we're talking about. The second one's resistance training. Hands up if you do any sort of strength training, whether it's your own body weight or weights. Okay, so this is the one where often there's lots of room for improvement, because often we're like, I don't know how to do that, or doesn't really appeal to me. Right? This is one that's really, really important. So it's important for bone density, and I know with multiple myeloma, resistance training and weight bearing can be contraindicated. And there are ways that we can work around that from a fitness perspective. Okay? This is the one that is good in terms of helping with ideal body composition, okay? Because it increases our lean muscle mass and helps decrease our fat mass, and it keeps up our metabolism. Okay? So it can be standing there right now, okay, and moving your arms, or stretching your leg out in front and working your quadricep muscle, or when you're brushing your teeth at night, going up and down on your toes and working your gastroc and soleus calf muscles. Okay, all of those are resistance training activities, okay, and really important, and we have separate guidelines for them that I'm going to show you in a second. And then the last aspect of fitness is one that most of us ignore. Okay, I taught fitness for years, and people would come into my classes and then they would leave before the stretch. Okay, this is the one aspect of fitness that's the easiest for you to change, okay, and the easiest for you to do. This is stretching, and I always tell patients from the top of the head to the tip of the toes, some point during the day when your body's warm. So it can be after a shower in the morning when you're limber. It can be if you've done a little bit of a walk, just stretching, and it doesn't have to be a 60-minute routine. It can be 5-minute scan, okay, and seeing where are the kinks in your bodies. Most of us, when we're stressed, so if you're sitting in a patient's or doctor's waiting room, if you're driving your car on Crowchild and there's traffic, we get stressed. As soon as we get stressed, we tend to hunch, okay? As soon as we hunch, what are we closing off here? As soon as we do this, or we sit slouched in our chairs, what are we closing off? Your lungs, right? And where does all your energy come from? Your breath. So as soon as you sit up, and everybody can just do this right now, just sit up nice and tall and roll your shoulders back. Okay, this is stretching, okay? So this, yeah, I know, right? You tend to roll out. Okay, this is stretching. If you want to, hopefully you know the person next to you, just open your arms. Say hello if you don't know them. Try not to hit them. Or give them a whack if you know them really well. Okay, this just stretch. This opens up your lungs. Okay, you're able to take a full deep breath. Okay, your breath is where your energy comes from. I'm a yoga researcher. I've researched yoga for the past 16 years, and I always tell people, if you do nothing else, you should do yoga because you get all the physical activity benefits, okay, but you also get this centering and this relaxation benefit, and it's from the breath work, okay, because you link your breath to your movement in yoga. Okay, so just stretching like this, though. This is yoga, folks, if you're doing this, and then rounding out, okay? Opening and closing to get that lungs open. So that's your stretching, and that's what you should be doing when you've done nothing else all day. Just stretch at the end of the day. How much and how hard? So starting to get to when do we do this? How much should we be doing? So we have cancer-specific guidelines. They are the exact same as they are for healthy Canadian adults. Okay, so the ACSM, the American College of Sports Medicine, the Canadian Cancer Society, and the National Cancer Institute of Cancer in the States have come out with guidelines for how much activity you should do. And they say here that you should engage in 150 minutes of moderate to vigorous activity a week, so that's 30 minutes of aerobic activity most days of the week, resistance training at least twice a week. Okay, and resistance training requires a bit more knowledge of what you're doing to make sure you're doing it well, and that's where some of the resources might come in here. Stretching daily, okay, oh, clicker, there we go. And I've got pelvic floor on there because that's becoming a big one in terms of when we focus on core work. You might have heard of the term Kegels from a rehab specialist, but all of us as we age, the pelvic floor muscle becomes of concern and it can impact activities of daily living. And so we often add in the pelvic floor training as a component of fitness to be engaged in. Okay, so those are our guidelines. Now, moderate to vigorous may not be where everybody are when they're starting, so we always tell people to start where you're at and to engage in exercise that is comfortable for you. Up here on the side, this is the scale that we actually use when people are engaging in exercise. This scale is called the Borg's Rating of Perceived Exertion. Okay, and it goes from 0, nothing at all, to 10, very hard. So when you open your eyes in the morning, you're a 0, nothing at all. You're not engaging in any form of strenuous activity when you first wake up. 10, think of that like Sidney Crosby on a breakaway. Okay, most of us are not elite athletes and we're not training at that level. Okay, for cancer survivors, when we get somebody going in a program, we want them to start in that light zone. And as they work up their fitness and their capacity to engage in heavier bouts of exercise, we work them into the moderate to even the somewhat hard. And as they gain fitness, then more often they're starting their workouts in that moderate and working into the somewhat hard or hard zone. Okay? My 2 and your 2 and your 2 can be different. Okay? So it's you to gauge, how does this feel for me? When I've got energy, I can push it a bit harder. When I don't, I'm going to dial it back. Okay, the Borg rating of perceived exertion is used with elite athlete training, so the exercise physiologists use this with athletes when they're training for the Olympics, and it just is a really easy and nice way to keep people in tune with their bodies and their energy levels and how hard they want to push it or how much they need to dial it back. Okay, so all of that to say then, what should we be doing? So we've got our guidelines, we've got a lot of evidence. There is no evidence to suggest that if we screen people appropriately and put them into programs that exercise is not safe for them, okay? So we know we can adapt fitness and exercise to anybody. In Alberta, we have just started this January the Alberta Cancer Exercise Program, so that's what I want to tell you a little bit about. So this is a provincial project. It's myself here in Calgary, and the lead person here working with me is Tanya Williamson, and you can see CEP. That stands for Certified Exercise Physiologist. So that's the top designation in the kinesiology world for somebody who's working with fitness and prescribing exercise. So they have the ability to screen and prescribe exercise. And then in Edmonton, it's my colleague, Dr. Margie McNeely, who's a PT and an associate prof up there, and Chris Sears, who is also a certified exercise physiologist. So this is a provincial program, and really the goal of ACE is to build exercise as standard cancer care. So we have 5 years of funding to convince the powers that be, and by the powers that be, I mean all the patients in the room, and then all the healthcare providers, and then the administrators. So we want this to really take hold at a grassroots level so that patients demand it, and therefore the system will respond and say, okay, this is something that's important. It's for all cancer survivors, and that's the really nice thing about this project is that we don't have a ton of inclusion-exclusion criteria to keep people in or out. It's not just breast or just prostate. It's across the board. We're recruiting 1,000 people across the province. It's a program, so this is about implementing something in the community and then assessing the benefits. Now, as researchers, we have some embedded studies within it. So we're looking at the cost of it, which is a big one for the system, because if it's going to be something sustainable, they want to know what does it cost to actually deliver it. And we have an implementation and an effectiveness study. So we've got patient-reported outcomes and fitness outcomes and biological outcomes that we are collecting during this to then again provide that evidence back to the system to say, here's what it does and here's what it costs us to do it, which is essentially what we're doing. So it's got really 3 key features of it. So it's screening and referral. So we are embedding our exercise physiologists, those people, into the clinics so that we can have referral right from the healthcare providers to the CEPs who then screen the individual. We use a standardized form called the PARQ Plus, which is Physical Activity Readiness Questionnaire. And the CEP, in most cases, is able to screen. If we ever have a question, we go right back to the physician or the nurse to say, we need clarification on this before we can assume it's safe for them to come in and exercise. That screening also allows us to tailor the program to the individual, which is really important because when someone sees benefits from a program because it's been tailored to them, they're more likely to stick with it. Okay, so that's the big first piece, screening and referral, and we call this our clinic to community model. The second piece is the community integration. So we don't think, and nor will it probably ever happen, that the healthcare system itself is going to deliver wellness in that clinical setting. They're already full to capacity with treating the illness. And so we don't want to reinvent the wheel, and so we've gone out to the community and partnered with community organizations. So in Alberta, we're partnering with the City of Calgary and with the YMCA. And then as we move out across the province, we're partnering with other municipal and Ys. So we've got City of Red Deer on board, City of Medicine Hat, and the Y in Medicine Hat. So we're just trying to use the fitness facilities that are in place in the community, and then we provide the professional training, the third part of this. So I, along with a colleague, have developed a cancer and exercise training. We provide that to all of their personnel, and then we give them a manual of operation for the actual ACE program, and they deliver it. So it's delivered in the community where the cancer survivors live. Some of our earlier work in breast cancer showed very clearly that when people had access to a fitness program less than 10 kilometers away, they're likely to adhere to it 2 times a week, versus if it was more than 10 kilometers away, they're not likely to keep on going on a regular basis. Okay, so it's really important for us that we integrate this into the community and it's delivered as a fitness program. The actual screening process and intake form requires physician approval and notification, right? So we work with the CEP and the physician, and then once people come into the ACE program, you essentially get a program that we've been calling for years our Thrive program. So this is a very specific fitness evaluation. So you get this within the ACE program. So it's a physical fitness assessment, and then the CEP triages the patient into one of basically 3 programs. Full into the community, they're okay to exercise. They may need to go back to rehab services. So if we think they've got a specific issue that they shouldn't be exercising yet, we refer them to physio or to rehab. And then the third one is they're okay to exercise, but they need more direct supervision. We don't want them just in the community. And so that's almost anybody who is on treatment, and they come in under the CEPs. For us in Calgary, it's at my Thrive Center at the university or at the Reach Center at the Holy Cross. Okay, so we're making sure it's safe by having these different levels where we can send people into the program. The big word on there is it's all free. So this is funded for the next 5 years. So anybody who comes into ACE gets the evaluation, the screening, the evaluation, the program designed for them, and then free 12-week program. So the classes are all delivered in a group-based setting. And that's really important for us because that is how we think exercise is best delivered in terms of potentially enhancing the social support element. Because you're coming into a program that is all cancer survivors. And we've seen this have a really strong effect across our breast study and our prostate study, our head and neck study, and our neuro studies. Okay, and so we're waiting to see with ACE, because it's more of a mixed group, it's not just breast or just prostate, will we see the same thing? But that's one of the things that we're interested in. And then the assessment time point, so baseline 12 weeks, 24 weeks, and 1-year follow-up. Most of the tests are done. It's a mix between at the university and in the community setting. But we're really, our goal with all of this is to make sure that what we're building can be sustainable, and we've already seen this. So we've had about a 60% uptake of the first people that have gone through the 12-week program going into a 12-week maintenance program. And that one they pay for themselves. So you get the first 12 weeks free, and then it's in the community and you can access it. A little bit more here in terms of inclusion criteria. As I said, it's all cancer tumor groups. within the first 3 years after diagnosis and treatment. So that's an important criteria. We're trying to get people that have maybe more of the immediate side effects. We have and are able to take in people that are outside of that window if they come with specific needs that are tied to their cancer treatment that are ongoing or long-term side effects. Over the age of 18, and when we screen them, they have to be able to participate at a minimum in mild levels of activity. So this just started in January, and you can see here we've had really great demand. And this is all based on demand. Our city partners, the City of Calgary Recreation and the Y, have been awesome at saying, if you have enough people, we'll make more classes, and we can train more individuals to deliver it. So this 100% runs on demand. We have filled all of our classes that we've run thus far. We have a drop-in program. So how many people in Calgary are familiar with Wellspring? Okay, so my group runs all of the exercise classes at Wellspring. There's 4 classes there a week, plus they've started delivering ACE classes. And so those ones are available at the Wellspring on a drop-in basis as well as a registered program. And then we have our Thrive Center. So you can see we're all over the city, and that's one of our big things. We want to be in every quadrant so that we can hopefully be able to deliver something that's convenient for individuals. So this is the start of ACE in Calgary. In Edmonton, they've got 4 locations running, and they're just as busy as we are. We've already put through our first 120 people since January, so it's been steamrolling and going ahead. And this fall, we move out to Red Deer, Medicine Hat, Lethbridge, and Grand Prairie. Those are our first 4 sites that are ready to start in September, with the goal that we combine this with the AHS's active living program, maybe where ACE is delivered in some of our community locations, or it delivers as a standalone. So we'll see how that goes, but it seems to be something that is catching on. And again, as long as patients demand it, we will find the facilities and the trained personnel to deliver it. And really, it is about this. It's about having the expertise and going into an environment where you know it's going to be a safe program. So this is a picture of one of my exercise physiologists in our Thrive Center working within. There's actually a group class going around with this lady, but we have, depending on the size of the class, 1 to 6, 1 to 8 is our instructor-patient ratio. So you can get very focused and guided and helpful expertise telling you how you should be adapting exercise. And that's really the beauty of exercise as an intervention. We can take anybody in this room and give you something, and you may have sore knees or hips or restricted range of motion. And the beauty of exercise is we can tailor it and to address any of those limitations or needs. So we have people coming into the ACE program who have been very fit and can do all sorts of things, and other people who are starting exercise from a chair, and it works. So I just briefly want to tell you just about a couple other programs that are available. So ACE is our big one. ACE is our go-to one. We are working with the Putting Patients First online screening forms to have that become one of the resources that patients can be referred into. And then we're working with clinicians to ensure that they're aware and their healthcare provider teams are aware of this as a resource and that it's available to everybody. Our other programs, so Yoga Thrive, as I mentioned earlier, I've been a yoga researcher for about 16 years, and I really, truly believe in the power of yoga as a physical activity option. Because I know if there's one thing when you're diagnosed with cancer and all the evidence is walking programs, and if you get sick of walking, you want to have other options. So that's why we started researching yoga for cancer, was to say, well, is this a valid and evidence-based form of physical activity? And we started as a small project, and now this is a sustainable community program. So this runs in Calgary every 12 weeks, and we run it all year long, and we put through probably 500 people a year through our Yoga Thrive program. It's a fee-based program. It covers the cost of the yoga instructors in the community. So it's 12 weeks of a therapeutic yoga. It costs $90, and it's in locations all over the city. Locations all donate the space, and then the fee goes just directly to the instructor to cover their time and expertise in delivering the class. It's specific to cancer survivors. It's open to survivors and support persons. And that's one thing I will say with ACE. Right now it's just for survivors, but our maintenance classes that are fee-based are open to the support persons as well, so they can come into that. So that's our Yoga Thrive program. We also have the Wellspring classes that I mentioned already, and then we've got our Thrive Center at the university where all of our programs run. But that's one place where if you're looking for more focused, structured feedback on activity and you don't want to join a class, you can come right there, and there are trained kinesiologists who operate that gym on a volunteer basis, and you can come in and get some more feedback or options on what you can be doing from a physical activity perspective. Okay, so we've got a few things in the city, and hopefully as we grow over the next few years, we'll have them across the province as well. So the summary. The summary is to get moving, and it's to move more than you are right now. Really, I always tell people when I do these talks would be best if we were, well, if it was a sunny day, I say we could have been in the pool doing water exercises, right? But it's about moving, right? And not sitting. So trying to avoid the sitting as much as possible. We always tell people start low and take it slow, right? So you want to start with less than you know you're capable of doing and work it up gradually. Because if you do that, the odds are the exercise is going to feel more enjoyable, and if it feels more enjoyable, you're more likely to keep doing it. Okay, we stop doing things when it doesn't feel good or we don't see the benefits from it. Okay, and with exercise, as long as we adapt it, you should always feel good when you're doing it, and you should feel better after than when you started. Okay, try to incorporate aerobic, strength, and flexibility exercises. ACE is about all three. All of the programs we run really are comprehensive programs, full body programs that target all three elements of exercise. And always remember, while those guidelines are out there and they may seem intimidating if you're not currently active, just starting with a little bit can start to improve your health. Okay, we saw survival benefits not at that 150 minutes, but at 90 minutes is where we see most of the evidence for survival benefits. So starting lower and building up slow can make a difference. And then I would encourage you, if you're a patient or a family member in the room, to ask your healthcare provider about the ACE program if you're in Alberta. From BC, not so much, but hopefully eventually they'll have it out there. The goal of ACE is to provide a template that can be disseminated nationally for other provinces. And with that, I will end it there, our contact information, and I'm happy to answer any questions. Thank you.